Hello, everyone. I hope you are well. Thank you for joining us today. My name is Dr. Calynn Lawrence, and a little bit of information about my education. I have a doctorate in pastoral counseling. I am a multi board certified trauma specialist, and I am a credentialed neurocriminology and neuropsychotherapy professional. And I am the founder of the Holistic Healing Source. So I am very happy that you're attending this free training. So let's go ahead and get right to it. All right, so this lesson is called Common Ways That Trauma Forms and Its Effects on the Body, Behavior, and Decisions. Let's start off with what is trauma? So, a lot of people nowadays, especially with the dawn of the internet and social media, they throw around the word, excuse me, they throw around the word trauma quite a bit without knowing what it actually clinically is in reference to. Trauma is an invasive emotional response to experiences and or circumstances that were harmful or threatening to the person. It can result in heightened stress and other ongoing adverse impacts on a person's wellness and ability to function. And trauma can happen to anyone of any background, race, age, culture, occupation, sexual orientation, anything. It can happen to anyone. Now, the actual DSM 5 qualification for trauma is obviously going to be a little bit more uh, comprehensive or in depth, but this is just a good general starting point for what trauma is. In the moment where these traumatic emotions are at peak, one may experience acute traumatic stress. That is one of my board certifications as a member of the American Academy of Experts in Traumatic Stress. One of my board certifications is as an acute traumatic stress specialist. So, acute traumatic stress is essentially measured within the first 30 days of onset of the traumatic event, experiencing those heightened symptoms of fear, anxiety. You may have nightmares. You may have recurring flashbacks. You may have difficulty sleeping and things like that. So those things within the first 30 days of the onset of the traumatic event would be considered acute traumatic stress. If the emotional responses to the traumatic events or circumstances continue for a long period of time and interfere with everyday life, one can develop PTSD. I go a little bit more into what PTSD is in our common mental health conditions presentation. So if you haven't seen that one, check that one out. That's a good foundation for this slideshow. But yes, one can develop PTSD if those symptoms of the traumatic event carry on, um, long past the actual onset of the event. Stress and trauma may also worsen mental health conditions such as depression and anxiety and substance use disorder. So, when you are dealing with mental health conditions already, having additional stress and trauma can actually worsen those. It can also be the onset of clinical anxiety and depression and substance abuse disorder or substance use disorder. Excuse me. Um, the trauma can be the antecedent to those things, or it can be the exacerbator of those things if they already existed prior. So there's a strong correlation between the effects of trauma and chronic mental health conditions. Common causes of trauma. A traumatic event can be a shocking, scary, or dangerous experience. Some examples include verbal, physical, or sexual abuse, being a victim or witness of a crime, a divorce or long term relationship breakup, loss of a loved one, or natural disasters. A traumatic circumstance can include ongoing harmful conditions such as bullying, grief, neglect, abandonment, or shunning, homelessness, long term exposure to high violence environments such as war or high crime, low income communities, systemic oppression and marginalization. All of those would be circumstances. So just the differentiator between a traumatic event and a traumatic circumstance. In case it wasn't clear, a traumatic event is usually referenced as a singular occurrence, versus a traumatic circumstance is usually an ongoing occurrence. Now, the physical effects of trauma. Trauma takes many forms and has many symptoms, but we're just going to go over some of the more common ones that occur. Let's talk about how trauma physically affects the brain. Okay. If you also listen to the Common Mental Health Conditions slideshow, you also will have seen how we went over the different areas of the brain and talked about the brain and its functioning and all of that. So you'll already have a little bit of an idea about this. But if you haven't, trauma has a large impact on the brain neurologically and psychologically, particularly when it goes untreated by a mental health professional. The physical brain effects of trauma can include things such as altering brain chemistry and creating an overstimulated or dysregulated sympathetic nervous system, reducing signaling between brain regions such as the hippocampus, the amygdala, and other brain regions. So the hippocampus is going to be the memory center essentially of the brain. The amygdala is the fear center essentially of the brain and other regions. So that trauma is going to reduce effective signaling, or at least it can reduce effective signaling, and also cause those areas to be over or understimulated, which is not good. Reducing the volume of the hippocampus and increasing the activity of the amygdala, impairing the prefrontal cortex, which is responsible for executive functioning, which really would not be good. Executive functioning is essentially the CEO of the brain. Think of it that way. It controls a lot of our um, day to day thinking and processes and behaviors and reactions. So, impairing the CEO of the brain with executive functioning could really result in disastrous consequences. And then, lastly, increasing cortisol and norepinephrine responses to subsequent stressors. So, as you all know, increasing cortisol and sorry, norepinephrine responses is also not good, because those things can lead to also physical health ailments in the long run as well, in addition to the already psychological stress that you're going through with the trauma. So those are definitely something you would like to avoid if you can. These symptoms are likely to worsen over time without proper intervention as well. So, like all things healthcare related, prevention and early intervention is the key to mitigating a lot of high consequence um, high consequence symptoms of untreated mental health care conditions, or undertreated ones, that, as you can see here, can have very high impact on your day-to-day life and your quality of life, even your quantity of life. It's been shown that people who suffer from especially untreated trauma over long periods of time, they do tend to live, you know, noticeably shorter lives than those who got the proper intervention, whether you want to talk about it from the perspective of the increased risk of suicide, self-harm, substance use, overdose, and other self-injurious behavior, whether you want to talk about the increase in high blood pressure and heart attacks and things like that. There's a lot of things at stake when it comes to treating trauma and its effects on everything. So take it seriously. Going off of that thought, how trauma physically affects the body, it has the ability to cause long lasting problems within our body, especially when left unresolved, that include things such as recurring headaches or aches and pains around the body, shaking, excessive fatigue or insomnia, excessive sweating, memory problems. Again, we were talking about the hippocampus, dizziness or changes in vision, heart, lung, and kidney disease, cancer, stroke, diabetes, suicide, and accidental overdose. 8 of the 10 leading causes of death, from the study we referenced for this slide, 8 of 10 of the leading causes of death can all be tied back to undertreated trauma or untreated trauma. These symptoms are likely to worsen over time without proper intervention. Now let's talk about the psychological effects of trauma. Ways that trauma psychologically affects you. Trauma can have a wide-ranging and long-lasting psychological effect on people. Various factors may impact how we respond to trauma and what strategies work best for us to heal from it. However, if we do not take a concerted or make a concerted effort to work through trauma, as opposed to trying to bury or deny it, we can face a host of very difficult psychological consequences, such as developing PTSD, worsening depression or anxiety at the clinical level, with heightened potential for suicidal ideation, substance abuse, and panic attacks, difficulty concentrating and staying on task, increased emotional sensitivity and irritability, an obsessive need for control or defiance to quote unquote rightful authority. And to clarify that, essentially, um, what that means is if something is viewed to be a rightful authority. So, for example, this could be within children, right? The parents are the rightful authority over the children. But if they're dealing with unresolved trauma or undertreated trauma, they can then develop an intense defiance to the parents, or it could be the teachers, or if you're an adult, maybe it's your leadership at work, maybe it's your, you know, healthcare providers who would be the rightful quote unquote authority when it comes to, healthcare. If they're delivering, especially in the context of counseling or mental health, if they're delivering advice or things that they think would be a good practice for you to do to mitigate certain issues, and you are finding yourself to always be pushing back or finding yourself to not respond well to their direction, that would be considered more so the obsessive need for control, um, not necessarily over others, but especially over yourself. That can also stem from undertreated trauma, where you have a very difficult time just submitting to rightful authority in general. So, not necessarily in the sense of like, I wanted to clarify that because I didn't want it to seem like I was saying, like, okay, well, if a teenager occasionally, breaks the rules, then that's a sign that they're highly traumatized. Like, no, it's more so if it's a repeated, consistent, behavior that you're noticing. Or if an adult, every now and again doesn't agree with their supervisor, or, maybe every now and again feels like maybe their PCP is not seeing things exactly how, they want them to see them. Maybe there's a difference in agreement on medication or whatever when it comes to like their PCP. Like, and those things being occasional, that is different than noticing that you are consistently always in misalliance or defiance from quote unquote rightful authorities. Next, an urge to self isolate from loved ones. That's a big one when it comes to undertreated trauma. It definitely, and counterproductively, actually, makes you want to isolate in a lot of circumstances because, one, you're either dealing with the symptoms physically and emotionally of undertreated trauma, which makes it hard to have fun and have peaceable social interactions with others, or, you're just ashamed of the things you're dealing with and don't want to be a quote unquote burden on others, which, if you have a good support system, if you have good friends, if you have good family, then they will support you throughout your time of need. If you're actively working to get better and do better, most people, if they have, a good amount of sense, essentially. If they have a good amount of sense and they truly care about you, they will be there. They will be that shoulder to cry on. They will be that support system in your time of need if you are actively working to, heal and better yourself. So that self isolation from others is a big sign. And then also developing unhealthy coping mechanisms and habits that aren't sustainable or beneficial. So, whatever the coping mechanism is, whether that could be, jumping from, let's just say with dating, jumping from relationship to relationship with no break in between, with people who otherwise you would not on paper consider to be compatible, but you constantly find yourself in these relationships with men like that. Or, maybe in terms of like working, like going to work is a pretty standard day-to-day necessity for most people, unless maybe they're a stay-at-home spouse who's like raising the children and have a husband or a wife who's paying all of the bills, so they don't have to worry about the money type of thing. Or, if you're a child and you're still at home, like obviously you're a child, you shouldn't be worried about bills. Things like that. Or if you're retired, for instance, like if you're, an senior adult and you've retired, then you're probably not going to be going to work. But if you are, an adult between the ages of maybe, early 20s to low 60s, and you have not retired and you don't have the luxury of being a stay-at-home spouse, then if you are avoiding keeping stable employment for your financial benefit, whether that's intentionally and directly, why like you're quitting a bunch of jobs and never holding a steady job, or whether that's indirectly, where you're always getting let go or fired for things that could have been avoided. Let's say you're always late, and you logically know that if you're late so many times you're going to get fired, but yet and still you find yourself constantly late to work. That could be an issue with, like we talked about before, the executive functioning in the brain, in the prefrontal cortex. Like if that is impaired from the trauma, consistently being late is, a sign that you are not operating in a logical, optimal fashion. If you know that consistently being late to work and you need a job will get you fired, that's just an example of how that could manifest. So, the unhealthy coping mechanisms and habits don't necessarily have to be doing drugs. It doesn't necessarily have to be becoming an alcoholic, or, it doesn't necessarily have to be, cutting or, doing anything like that. It could simply be that you're, like I say, showcasing those other signs that I talked about that many people may feel to be a little bit less intense or noticeable, but they do add up, right? So, looking at the big picture of just how trauma psychologically and physically affects people, it should bring home the point of how serious, trauma is, and how the treatment of it should be taken very seriously. And then when you think about the intersectional identities of a lot of people, when you're serving vulnerable populations, being aware of them having multiple marginalized traits, multiple marginalized population traits, and how that only exacerbates not only the likelihood of them incurring trauma, but also the likelihood that they will then develop subsequent chronic mental health conditions as well associated with said trauma. So just being aware of that, someone is, let's say Juan is, young Mexican guy from a low income neighborhood, comes from a high violence area, maybe he's in a gang, maybe he's selling drugs, maybe he's been in jail before, and the incarcerated population is a whole nother thing that I can talk for hours about. Very passionate about legal system reform and prison reform and all of that. If you watched my doctoral capstone defense, you saw my advocacy for holistic prison programming post release and during incarceration. But anyway, I say all of this to say, if you're looking at Juan with all of those intersectional identities, maybe he's an immigrant, so he's an immigrant, he's Hispanic, So he's a minority, maybe there's a language barrier. He grew up poor in a high crime area. So there's those sociological inputs. All of those things put together are going to leave him with a much higher chance of developing trauma. But then, unfortunately, the double edged sword is that minorities, especially low income minorities, and especially male minorities, they do not receive the proper mental health care that they need collectively. They don't, whether that be for a lack of resources, a lack of knowledge, or culturally just feeling, especially among men, that, mental health care is a white people thing or a rich people thing, and that everyday people, especially minorities, they don't, spend time or money or energy on that kind of stuff. They just suck it up and keep going. So, even though that's very faulty logic from a scientific perspective, that unfortunately is very common. So, looking at all of those intersectional pieces, and how trauma affects the average person, let alone someone of multiple marginalized identities, and just being cognizant of that will really give you an extra added bit of empathy when dealing with those vulnerable populations, because it's literally scientifically backed, from a biological, psychological, sociological standpoint, that trauma, it does a number on you, and hence it should be taken very seriously. So, how does this directly affect behavior and decision making? Given the array of symptoms that unresolved trauma can cause, our behavior and decision making will undoubtedly be altered when experiencing some of these things. A few examples of how this can manifest in our day to day lives are reduced capacity for interpersonal relationships. When battling numerous physical and mental symptoms, it becomes very difficult to maintain close bonds with others. This can be due to our behaviors becoming overwhelming, dangerous, or offensive to others, or it can be due to us withdrawing from our family and friends due to poor mental or physical health and limited capacity for socialization. It could be the inability to maintain consistent employment, like I just talked about. Some of the symptoms of untreated trauma include both physical and mental impairments that would make it very difficult to keep many jobs, especially like I just talked about, the reduction in executive function, being timely, being able to handle intricate tasks, so on and so forth, follow processes. For example, if you are battling with sizably increased sensitivity and irritability, you may not be able to amicably get along with coworkers or clients and customers. If you are experiencing an obsessive need for control, this may make you become noticeably insubordinate or combative with leadership, as I just, talked about. If you are experiencing chronic pain or large shifts in your sleep schedule, you may not have the strength to do a job that involves manual labor, so on and so forth. Also, developing unhealthy coping mechanisms. Those who are dealing with untreated trauma have higher risks of engaging in threatening hobbies to self soothe that could include substance use, harmful promiscuity, gambling, self injurious behavior, or eating disorders. And because this is a spirit led training, I want to comment specifically on what is meant by harmful promiscuity, because especially within the Abrahamic religions, sex is often demonized, especially for women, unless they are married and having sex with their husbands. But fornication, let's say, sex outside of wedlock, is often demonized in a very unfair manner, compared to other quote unquote sins. So when it comes to harmful promiscuity, that is going beyond just, oh, I'm having sex and having fun with a partner, or even if it's with a couple of partners, it's consistent. It's, not to the point where you're putting yourself and your body at risk to have an extreme amount of partners, especially overlapping at the same time, where you are, if you're a woman, setting yourself up for risk of pregnancy and disease, and if you're a man, disease and possibly getting someone else pregnant, because STIs are a very real thing, and sexually contracted diseases, can be life altering, if not fatal, if left untreated. So if you are noticing that your promiscuity is going beyond, oh, I'm just having fun, I'm being responsible, practicing safe sex, I'm, not doing this to fill some kind of emotional void. If you're doing that and it's in a, consensual, controlled manner, then that is perfectly fine. That is not to say, like, because you're sleeping with your boyfriend or your girlfriend, and you're not married, like, oh my God, that's so harmful. That's not what I mean by that. I'm more so referring to people who are, you know, promiscuous to the point where it poses a real threat to their livelihood and their safety. And the last one, irrational thinking. If one is suffering from numerous psychosomatic, again, clinical term for mind body, that's what psychosomatic means in simple terms, like mind body. Numerous psychosomatic symptoms such as paranoia, anxiety, and confusion, they are more likely to struggle with logical reasoning. So if someone is dealing with all of these symptoms, they're paranoid, they're very anxious, they're confused, it makes it a lot harder for them to make logical reasoning. So, that should be noted. In other words, I say all of this to say trauma is very real and ought to be taken seriously. If it was not already clear how trauma can take a toll on us holistically, this presentation, should have conveyed that trauma is real and it should be treated as something of high priority. And showing you guys the reference slide as always. If you want to do some further reading or further research, these are the references I mainly pulled from for this class.